What's going on, everyone? Happy Saturday to everyone. Welcome to the Saturday edition of the Pandemic Update for Saturday, June 3rd, 2023. Hopefully everyone's staying safe, having a great day so far. If you had to take a COVID test, I hope you tested negative. If you did test positive, hopefully you have a full and speedy recovery, and hopefully you have quick access to treatments. Taking a look at India today, 237 new cases were added in India today, and it looks like they've added 4 more deaths today. So deaths are higher than yesterday. Yesterday, if you recall, they reported 2 new deaths. Moving on to our next story, this has to do with Thailand. We reported on Thailand about, I guess it was over a week ago now, and we're finding out here that COVID makes a comeback in Thailand as booster fatigue leaves doors open. So it's sounding like they are having a booster issue in Thailand where a lot of people are not taking the booster. And as you know, they were seeing a large number of severe cases in Thailand. So this is not good to see because, as you know, booster uptake here in the United States is relatively low, and Thailand has been saying that they've been having a lot more severe cases. So that's not good. It's a bad indicator of what could happen here in the United States if people decide not to take the booster. So it's something we're going to have to keep an eye on down the line. All right, here's something we're just going to read a headline on. 59% of long COVID patients had organ damage a year later. That's not good at all. It's something that we're continuing to see, and I'll make sure I add this to the website and tweet this out. That way you can see the full story if you should want to read this. Moving on to our next story. This is a relatively interesting one. Douglas County judge rules driver in fatal 2021 crash not guilty due to COVID symptoms. So this is in the Omaha, Nebraska area. And let's read some of this. A Douglas County judge ruled the man involved in a crash that killed one person is innocent because he was suffering from COVID-19 symptoms. Interesting. So because he may have had COVID, I guess they're saying that may have impaired him, and his judgment to drive properly maybe wasn't all that well, and therefore he is not guilty. How about that? All right, moving on to this. COVID-19 outbreaks at 7B long-term care homes after mask mandate for employees lifted. This, I believe, is up in Canada. And it's sounding like there are a total of 7 long-term care facilities that have self-reported as being in an outbreak. So that's interesting. They're actually self-reporting. Why shouldn't it be mandatory for care homes to report whether or not they have COVID outbreaks? And it does go on to say here, this does not include any homes with 10 or fewer residents, which are no longer required to report outbreaks. So that would signal to us that these outbreaks have more than 10 people in each outbreak. So there you go, at least 70 cases right there if you add up, 7 care homes. And let's just say they at least have 10 in each, so that makes 70, and it could very well be over 100 if you total up all these. So this is not good. It also says here, at a larger home, an outbreak is usually declared when there are 2 or more cases, and when transmission from within the home has not been ruled out, according to the department. So it also says just 2 or more cases could be considered, but nonetheless, nursing home outbreaks are still happening up in Canada, as they're happening here in the United States. We're just not hearing about them here in the United States. Trust me, they're happening. I've told you before, I've delivered to nursing homes, food deliveries to nursing homes. I've heard people coughing. I know it's happening in nursing homes. And what gets me most upset is senior citizens are who we are supposed to be taking care of. We're supposed to protect them at the start of the pandemic, and now we are failing to do so. All right, this is rather interesting. Sacramento health experts urge, key word, urge everyone to continue screening for COVID-19. Yes, so they're actually saying, come on, please get tested for COVID-19. And you know what? It's the God's honest truth. A lot of people are feeling, oh, this is not COVID-19. Oh, we were told COVID's over. It's not a real problem anymore. No, even the ones that are saying, yes, it's no longer a pandemic, like the CDC, the government, everyone, they're not saying COVID's completely gone. They're not saying that you need to stop being vigilant. What they're saying is, or at least in their eyes, the pandemic level of this is over. It's endemic, which, as we all know, you and I both know, I still consider it to be a pandemic, and I will for a long time to come. But what they're saying is, don't get so relaxed that you're not going out and getting tested for COVID when you feel you're getting sick or you have symptoms of COVID. And maybe tomorrow. I think tomorrow would be a great day. Sunday's usually a lighter news day or a lighter data day. I think tomorrow we're going to go over what the symptoms are of COVID-19 in tomorrow's pandemic update. We've done it many of times before. It's time we do a refresher for my newer followers that may not know what the updated symptoms are of COVID. Just because you didn't lose your loss of smell or sense of taste doesn't mean you can't have COVID. I see time and time again. Oh, no, it can't be COVID. I didn't lose my sense of taste or smell. No, it can be. There's a lot of different symptoms that could be coronavirus. Moving on to this. New Hampshire officials warn against COVID-19 test kit orders that were never placed. So what they're saying here, some people are recently receiving COVID-19 test kits that maybe they did not order. And officials are warning it could be a sign someone has your personal information. So be very careful. If you're receiving test kits that you did not order, make sure someone has not compromised your data. Always check up on your data. I mean, frequently check your cards, anything that you do. All right, White House set to tap Obama veteran Mandy Cohen to lead as the CDC. As you know, Rochelle Lewinsky did step down from the CDC, and President Biden has now picked Mandy Cohen. We'll see how that goes. Some are saying it's going to be the same as what we saw with Rochelle Lewinsky. Some are saying otherwise. I'm not going to speculate. I wish her the best of luck. I hope she does a good job. Moving on to this now. I thought we would try and get some COVID cases from some more states, so I was searching some random areas, and I did come upon this in Boston. Maybe this is something we'll start looking at more often. And take a look at this. I don't know if I can blow up this graphic. I'm hoping I can. And, oh, perfect. Here we go. Wastewater in Boston. Now, as you can see here, look at this. The average cases per 100,000 population is dropping. Hospital admissions are dropping. There's some issues here. Wastewater is rising, so that's a bad thing. But at the same time, cases are dropping in Boston. And that's just a sign. You know, people have to pay for a PCR test. Maybe they're doing the at-home test, and, you know, a lot of people are not testing at all. Also, we're watching hospital admissions dropping. Hospitals in most states are not required to report their infections or test upon someone entering a hospital. So because of that, look what's happening here. It's dropping. But at the same time, wastewater's going up. I mean, let's just face it. Wastewater does not lie. People cannot go and not get tested or not afford to get tested. Hospitals will not test people. But we can detect when there's a wave in wastewater. And there clearly is. It started before the Memorial Day weekend. Just like what we saw in New York State, it's rising in the Boston metro area. So there's definitely a wave going on. It could be hidden in the hospitalizations in cases, but it's not going to be hidden in wastewater. Everyone has to use the bathroom, and the wastewater does not lie. So be very vigilant if you're in Boston, and also be vigilant if you're in the New York City metro area. As you know, all New York City wastewater sites are rising. And finally, in the news category, or we'll call this the data category actually, Ohio COVID-19 cases continue to drop, number of deaths adjusted down, weekly coronavirus update, and they did have, it looks like they had 1,612 cases this week, and looks like they only reported 7 deaths this week, so the deaths were relatively low in Ohio this week, so that's not terrible, but we will take a look at Ohio wastewater tomorrow. Remember, Sunday is our weekly wastewater update. This week, the national positivity for Walgreens was 22.4%. We will hopefully get a new update out of them on Monday and either do a video from it or incorporate it into the Monday edition of the Pandemic Update. We have nothing for this day in COVID history. We will have something tomorrow, it looks like. National wastewater is dropping. Again, wastewater update's going to be tomorrow, so we're going to go over a good number of these sites tomorrow. We'll just randomly go through them and take a look at the variant proportion. Next update's going to be end of next week. Let's just take a look at the top variant, which is XBB.1.5 at 53.8%. XBB.1.16 is at 15.1%. XBB.2.3 is at 4.9%. New Jersey does update the hospitalizations on Saturday, but only 58 out of 70 hospitals reported. Therefore, the hospitalizations dropped to 179. 9 people are on a ventilator, and 12 people are in the intensive care unit. Taking a look here, we did the weekly COVID forecast, all the different viruses yesterday from Hubbub World. Check that out. The video is up here on the channel. And continuing on down here, we still have not gotten a Pennsylvania update. I think Pennsylvania is done updating, but we can look at some local stuff. And locally here in my county, Philadelphia County, you got to understand something. It was well over 90 degrees yesterday, so there were likely a lot of respiratory calls, but hey, 812 calls yesterday. That's a very busy day. That is in my concerning category. Let's take a look and see what's going on right now in the metro area. You can see Montgomery County, just 9 calls right now, so that is less busy than what we saw yesterday. Let's take a look and see what's going on in Chester County. Not terribly busy in Chester County. I have been noticing this, though. There's 2 respiratory calls right now, and these are different than the 4 that I sold just an hour ago, so it is a relatively busy day for respiratory calls. And when I see that, I get concerned that some of it could be a respiratory virus or COVID. No update out of New York State on the weekend, so we'll just repeat yesterday's numbers. 546 new cases. 4.9% positivity rate, 4.2% is the average positivity rate, and as you know, New York State wastewater, all the New York City sites that are reporting, they are rising at this time, unfortunately. They're seeing a wave. We'll see how long that lasts. Eventually, it will continue up. Eventually, it will drop. I think it could continue up for a little bit while because we are probably still seeing the post-effects of Memorial Day weekend. But I should note, this rise in New York City started before the Memorial Day weekend holiday. Let's take a look at some international data. I was hoping I could show you some international variants, and actually what I can show you is a little bit of the international hospitalizations. We're going to have to zoom this in, and it's hard to see. And you can see here, I do have several countries selected. And this is our world in data, and you can see the majority of the countries that I have selected. For some reason, it's faded out. I wish it wouldn't be. But the majority, there we go. The majority of the countries I have selected are not reporting anymore. You can see here, several stopped reporting back in March. And then as we continue on here, some are still reporting. And some are just so low because they probably don't test people that are being admitted to the hospital. Some are just, really low, which, again, is good to see. But look here at the United States. The United States continues to be at the elevated level. We're pretty much one of the highest in the world, and I get it. We have a higher population, but again, it's ridiculous that our country continues to lead the way in the number of people hospitalized, the number of people dying, and yes, our wastewater is just ridiculous. Let's look at a few international cases. As you can see here, I have to refresh this. And as you can see here, worldwide, 27% down. Deaths are 50% down. You can see here, not a lot of rising at this time. What's going on in Mako? I don't understand this one. 380% increase in cases, 100% decrease in deaths. We'll take another look at the international numbers tomorrow. Again, they're less reliable over the weekend. Later on today, we are going to have our monthly staffing shortage. There was the jobs report that came out yesterday. But I assure you, despite that jobs report, there's a lot of places that still need help and are short-staffed. We'll take a look at that later on. If you enjoyed this video, give it a thumbs up. If you enjoy the content you see on my channel, please consider subscribing down below. If you want to see more content like this, where my main focus on this channel is to help keep you safe and report on the news that you need to hear. Alrighty, thanks for watching. I'll see you all again next time But until I see you again next time, stay safe, everyone.